so there has to be an incident commander. And while the mayor is the chief executive, he's assigned me to be the incident commander of this incident. We use common terminology across the board so everyone knows when we speak of something. And a good example going back to the fire service is that in California, an air tanker is an airplane. In Ohio, an air tanker is a truck with water on wheels. So that's, maybe a rudimentary example of common terminology, but when you can see across the country, we would call things different names, but incident command system helps us drive a common terminology. And the focus is really on safety of the responders, because you really, while a disaster, you cannot afford to lose responders, and the COVID crisis is a great example of protecting our staff so we continue to provide service to the community and the efficient use of resources. And you can see, especially in the COVID disaster, the need for PPE, gloves, masks, ventilators, how it was projected we don't have enough, and that is true, and it's been a logistical exercise to manage resources. You have to sometimes prioritize who gets them, which is being done. So all the tools really to help us get through this as best possible are available through the incident command system, and we are very fortunate. We've had a staff that's been training and doing all the things that you need to do, exercise, write plans for now almost 7 going on 8 years as a community. We used it already during the tornado a few years ago. We had a fire in a city facility, a number of things we've used it for, and I believe we're better off as a community because of it.
Thanks, Bill. And what we did was actually starting back March the 16th, and prior to that, having discussions and putting together daily meetings, daily briefing by all our staff, and it included Schuyler Township, Jackson Township, Prairie Township, the schools, the chamber came into play, the town center merchant group came into play. So, did I say schools?
Yes.
So that we had as big an audience as we could in understanding and being able to get input as to whether the peripheral effects of this pandemic. And those went on daily. Now we're down to twice a week of having meetings and going over the discipline of the incident command. During the time, we've also itemized all the things that we have tried to, all the things that have impacted our community, our employees. And I've got 3 pages of different things that were impacted, cancellations, how we manage our personnel when they report to work, meetings that are now either canceled or put on some type of telephony reporting or through the webinar or whatever it might be. So what we're doing now is going back with these 3 pages of things and saying, okay, what can we undo and try to get back to halfway being normal. So that's a quick briefing as to what we're doing, but I would be very interested in hearing questions from all of you who are listening. Tim, you got a question?
Let me unmute again. No, I don't have any questions. You know, what we've seen from the food bank, Mid-Ohio Food Bank, has been the good response. And I also wanted to thank you personally for stopping out the other day to speak to the National Guard and Ohio military.
Amanda?
Yes, Mayor?
Any questions, comments?
I'm just stepping outside so that you all don't hear the robots in the background in the house. It's an educational robot. Just a little insight from where we're at, you know, lodging and travel and tourism was certainly on the front line of the first industries hit by COVID-19, given that, you know, the fear of spreading and certainly the spread I'm sure in part was caused by people moving around. So now we've been working with our partners, just talking about reopening. We had 2 hotels close of our 16 during the crisis, and they're all planning to open up as early as June 1st. We had a lot of meetings and events that were canceled. So we've been coaching our partners on rescheduling those meetings. That's been our message from the very beginning was, whenever possible for a group tour partners or meeting partners, don't cancel, just reschedule if that's at all humanly possible. So as you said, going back through your list, just checking in with some of those folks from the very beginning who we knew were putting things off or were struggling with those tough decisions.
Oh, I'm on the phone. I'm not on my.
Thank you very much. Well, one of the other things we did was early on, we set up a call center over at our senior center to take calls. I think it's 14 hours a day during the week, and then on weekends, some limited service, so that we were being responsive to the seniors if they need medication delivered to them, food, or whatever the case may be. And then we started doing outbound calls to around 2,000 seniors, doing well-being checks with them. And then we started doing well-being checks with our companies, our corporate citizens. And I think we're over 400, maybe 500 calls now, checking with them and doing a well-being check. So we're trying to stay on top of it. We also have regular conversation with the Franklin County Board of Health. We have regular conversations with the other Central Ohio mayors, the Mid-Ohio Regional Planning Commission, and then the Ohio Mayors Alliance, which represents a lot of mayors throughout Ohio. Such issues as, are you going to open a swimming pool? And the governor's going to give us guidance on that, I think, either today or tomorrow. Do you cancel the 4th of July? And we have canceled the 4th of July and hate it. And then starting Little League, when can we start Little League? So some things that are high impact that yet are to be decided are concerns, that we're wondering what we're going to do with them.
Yeah.
So any other questions?
You got a choice.
You got to see the evening, watch late night news or.
Oh, yeah.
There's already some spikes in California.
So
Okay.
speaking of events, Mayor, sorry, I wasn't sure. I heard somebody talking and I wasn't sure if they were asking a question or not. We've had a few people reach out and ask us about some of the other events throughout the city, like the Summer Sizzle concert series. Is there any plan to maybe make those virtual at the beginning of this summer and then ease into in-person events?
Well, we're shooting for having something on, trying to think, the weekend before July 4th. But no, we have not talked about virtual. We have talked about virtual interaction with our program to take care of children, the Latchkey program, and virtual programs for our seniors, but not for the sizzle. We have lifted the restriction on the DORA, so that will be in effect, back in effect this Friday, but nothing more virtual that I know of.
Okay, we definitely appreciate any information any of the event planners throughout Grove City have as they're making those tough decisions moving forward, so we can keep our partners informed.
Right. Did I see Mr. Molino on there someplace? Guess not.
I can unmute myself.
Ah, there you go. Do you have any questions, comments?
No, just appreciate what you're doing. We have, of course, a lot of, on the insurance industry, a lot of businesses that we have had major impacts, and are certainly looking to get back to the business, even though it's going to be a new way of doing business. So we've had, a lot of concerns over business interruption, is it covered, things like that. So,
Oh, yeah.
yeah, it's been interesting. A lot of advice has gone out. So we're just continuing to put in.
Yeah, well, good point. I'm glad you mentioned that, because that's business interruption. That's not a minor thing, is it?
It is not at all. It can definitely have an impact. And from the National Association of Insurance, they are looking at whether or not how that's going to impact how the insurance companies, if they decide that the companies need to pay for those and actually endorse the policy to cover that expense, how's that going to look in the future? So
Yeah,
something that's being discussed currently.
yeah. Well, I appreciate that. John, can you hear us?
Yes, I just was able to get back on. No idea what the problem was, but I'm back. So sorry I missed the sound, but everything looked good.
No, that's okay. The other thing we're working on is can we help our businesses out by trying to reboot some things? And can we have some matching dollars that we might be able to put together? So hopefully we're going to come up with something in the next 30 days to help businesses, and mostly the town center area, which has now taken us 40 years to get booted and to have it revitalized. And now we've been really put on our knees with the businesses there. So just from a more global standpoint, we are looking at other ways to try to help the community.
Yeah, we all appreciate that and look forward to, the ideas that come forth from, whether it's from you or city council or the community or the businesses themselves. But we think that when we pull together, there's going to be great solutions.
Bill, you have anything else?
No,
Well, thank you all very much. And we are going to try to reopen most of our buildings here in the next couple weeks, and other communities are going through the same thing. And it's tough, as Bill mentioned earlier. Our primary objective is making sure that we keep our staff as safe as possible, because we got to keep our workers available, and then it runs concurrently maintain the safety of our general public. So thank you all very much, and God bless.
Thanks, Mayor.
Thank you, Mayor. Thank you, team. Thanks for joining us this morning. Everybody have a great day. We'll see you on the next Zoom call.
Thank you, everybody. And thanks, Sean, for hosting this. And we appreciate
Our
all the hard work
pleasure.
you guys are doing. Keeping
Oh,
everyone
thank you,
informed.
Ned. I appreciate that. Thank you.
Echo that. Thank you all.
Stay well, everybody.
Yes, thank you.